Yes, I'm going to nursing school and I don't want to be a med-surg nurse.
If you're a burnout nurse,
There are so many different nursing jobs. Good morning. It is 5 a.m. and I wasn't planning on being up this early, but I've started back to teaching kids English, and that has me getting up earlier some mornings, and Raylan's got me up twice in the last 30 minutes, so it's time to get up or lay in bed half awake. That is okay. It seems like this is the best time of day to do some nursing stuff, schoolwork. Before I get started on that, Raylan's awake. Raylan's like, I don't feel the best, so we're gonna prioritize her morning meds first because that will help her feel better. She's got one med in here that is just great. And this ties into why I have an option for people who don't like nursing. One of my first posts I did, I told people I don't like needles, I don't like big bloody wounds, and I'm pretty sure I said I knew I didn't want to be a med-surg nurse. And almost everyone starts out in med-surg. So here I was saying I didn't want to do what almost every nurse, it seems like, starts out at, or what they're told to start out at. So I'm just looking through all her meds and pulling out the one she gets. She gets a lot in the morning. And yet, I know nursing is the right career for me because I already have a job lined up. I can be my daughter's home nurse. If she has enough nursing hours that she doesn't need home nursing, I can be a home nurse for another person locally. And that doesn't require bloody wounds, doesn't require poking people with needles. It does require other stuff that maybe everyone's not good at. But I feel like the people who would get stressed or overwhelmed with med-surg because it's so many patients and you don't have time to do everything maybe as well as you want to would love this job. And if you're a burnout nurse from COVID, or if you've got your nursing degree and then you're like, what did I just go into? Or if you're in med-surg and you can't keep up with the pace you need to and you feel bad because you're not giving people the care you want. Or if you work at a long-term care facility, man, especially if you work in a nursing home and you feel bad because you can't keep up with the pace and it's not fulfilling to just do the bare minimum for patients, I really consider you to look into private duty nursing because I know hospitals and med-surg and long-term care are not for me. I know because I've seen those jobs. I haven't seen long-term care other than I had two grandmas in nursing homes that we spent a lot of time, or a grandma and a great-great-aunt. We spent a lot of time visiting, so I know home care from that, or nursing homes from that, and from talking to other people. But here's how meds ties in. Raylan doesn't feel good. I immediately could go get her meds because she's my only patient. Right now I'm not a nurse, so I'm just a mom. But when I'm her nurse, or if I go do home nursing at someone else's house, if they need pain meds, I can help them immediately. I mean, not immediately, it takes a while to get all her meds ready, but way faster than if I have 5 patients. So, and there's a need for private duty nursing. It doesn't pay as well, or it used to not pay as well. I don't know. In Illinois, a lot of us parents really fought for improvement in home nursing because we have kids we want to be home and some of them they can't. They don't have enough nursing hours to be home. So there was a lawsuit about it. There was a lawsuit about that basically, hey, you have to improve conditions so that these kids improve conditions for employees so that these kids can be home, because that's the whole point of this, like that you give them enough nursing hours they can be home. I don't know, there's a lot that goes into that, and to be honest, I see both sides. I see why it's an impossible task, but our state did do more, and they did increase nursing wages for home nurses quite a bit. And I don't know what everyone makes or what everyone pays, but I'm pretty sure that our LPN is making more than she could make at a nursing home. Some of it depends on the family you work for, because I threaten to switch agencies if they don't pay the max amount. I know how much Medicaid reimburses our agencies, and I'm like, who's going to pass on the most? Because you're the agency I'm going with. I've advocated better care for our nurses, because I know the better taken care of they are, the more happier they'll be, the more likely they will stay. I was reading about someone who hated their job as a nurse right after getting out of nursing school. Sorry, the sliding swivel. And I'm like ducking down. And what they hated was how busy it was, like how insanely busy they were. and they didn't feel like they could give the patients the care they needed. And our home nurse, she was a CNA first a long time ago. She actually quit being a CNA because she felt horrible about the quality of care she was able to give people. She's like, I couldn't give them the care they needed. Then I recruited her to come back to CNA stuff so she could work for us, and then she got her nursing license. And I think she mostly loves her job. I think she has days she doesn't want to come here. I mean, it's still a job, but you should consider private duty home nursing, because when your patient needs something and you only have one patient, it is so, these always break. It is so fulfilled. This was my flush syringe. It doesn't matter. Flush syringe means it's just like the water to put through the feeding tube, to flush the meds through. But we have a shortage of private duty nursing. And if you want a lower stress job, you don't have to feel bad. I think some people are going to tell me in nursing school, I think I'm going to hear this.
You can't be a nurse without doing MedSurg. You'll grow so much. You'll learn so much.
I'm going to do meds, and I'm going to get back to a better spot, and I'll finish. Be right back. Okay, she was almost back asleep, which I kind of thought would happen. But now, when she wakes up the next time, she will feel much better. I don't know how Chris does this. So, the thing I want to say is there are so many different nursing jobs, and like a lot of them are what I think is called Med-Surg, and it's just bedside hospital nursing. And a lot of them are working at long-term care facilities. It's places where you have like 5 or more. Ooh. Hiccups of the yawns, guys. It's rough getting up at 5 a.m. It's places where you have a lot more patients than it's realistic to give the quality of care that maybe you want to give if you're a really caring person. And we need some people to just suck it up and do the best they can in those situations, because that's how we have great med-surg nurses. And I'm very thankful for those people, but that's not me, and it's okay if that's not you. I think we can go to nursing school anyways. A little worried about clinicals. I'm a little worried about how overwhelmed I will be doing clinicals on a med-surg floor, or I don't do well with like big bloody wounds, and if I have some clinicals in a ER or wound care center. But I'm going to get through it. I'm going to get through it and remind myself that I have to experience this, whatever's in this clinical, but it doesn't mean I have to take a job in that spot. And there's nurses that talk on a phone all day. They're telehealth nurses. There's nurses that are more like social workers. They do paperwork to help get things done. We have a case manager for Raylan that's an RN that helps like just coordinate the care of a medically complex kid. And to be really honest, like I have a bit of a case management background. I've done case management. For Raylan, her job's probably easier than most because I do a lot of the stuff that she would do. Because I know my kid better, I can do it better, quicker, faster. But there's parents that don't have a case management background, and this person's invaluable to them. And not that she's never helped us, because she has, and she does a lot. And she does paperwork. It's not my job to fill out. So she is an essential part of Raylan's team. She doesn't see Raylan. She doesn't do any direct care as far as like, bandages and checking blood pressure. She doesn't do that stuff. There's school nurses. I wouldn't want to be a school nurse, but that's very different than working in a hospital. And there's private duty nursing, which is what I'm doing. I know that I'll have, a few hours with my daughter. Definitely open, if most of nursing hours are covered, to looking at doing private duty nurse in another home. I do really want to do clinicals at some local hospitals in case I find a job I like in the hospitals. Post anesthesia care unit. Those are the nurses that help you when you're waking up from surgery, and they usually have 1 or 2 patients. I've seen them do their job because I've been the patient waking up from surgery. And I've seen them do their job even better when it's Raylan being the patient waking up from surgery. And after she's awake enough, I get to come in and be with her. And usually I'm only with that nurse like for a little bit before like, okay, she's good enough to go to her room. And I've watched YouTube videos about PACU nurses. I think that's something that might be for me. So I definitely want to do clinicals there. But I want to tell you, Raylan's beeping. This is why she needs home nursing. Be back again. Okay. So now Raylan's needed me 4 times in the last hour, which with 1 patient, that's doable. It's hard to get anything else done, but I can definitely take care of her. If I had 5 patients that needed me 4 times in an hour, I see how I'd be overwhelmed. maybe that's why I'm scared of doing MedSurg, because I've seen how hard they work. And I know how hard of a job it is. And I appreciate what they do and realize I'm not up to it. All that to say, that's okay. And I'm getting ready to fill out my information for clinicals with Elmhurst. And I'm okay with them knowing, I don't think MedSurg is for me. Can you give me as many clinicals outside of MedSurg as possible so I can see what jobs are out there? I'm sure I will have to do some MedSurg clinicals. I get that. I need to see what that looks like. But I'm the one paying for the degree, and I'm paying for this education. It's okay for me to let them know this is what I'm hoping to get out of it. And I can tell them, yes, I'm going to nursing school and I don't want to be a MedSurg nurse. That is okay. That's okay to be honest. Maybe wait till you get accepted to tell them that. If you think it's gonna scare them away from, but we need nurses. And we need nurses in all kinds of nursing jobs. So if you're in MedSurg and you hate it, look for another job. And if you thought about nursing school, but there's certain aspects you're just like, not sure I could do that, look for another job in nursing, because I think there's lots of jobs. And I cannot wait to do some private duty nursing, and I really look forward to seeing what the PACU's like and seeing if that's for me too. I don't know. That's it.